Before we get to new treatments, let's talk a bit about what exactly heart failure is.
Well, heart failure that we're talking about today is the heart has been damaged so that it's not pumping to capacity. It's a chronic and progressive illness, and what our patients tell us is that they're short of breath doing their regular activities, that they get fatigued during their activities, that they're having more swelling to deal with, and as the disease gets worse, they start to have these symptoms just walking across a room, and then finally, at rest, having a conversation or being woken up in bed with these symptoms.
Dr. Walensky says there are many factors as to why heart failure cases are so prevalent during the summer, and what we serve isn't the only one.
Patients are also telling me this time of year it's too hot to exercise. I suspect there might be more non-compliance with meds, but we clearly see an uptick in hospitalizations. But I think this is just a trigger to talk about the problem in general. The issue is we have 1 million heart failure admissions in the United States for heart failure, and we'd like to make an impact in that.
So if you're diagnosed with heart failure, what can you do to manage this serious condition?
Physical activity, for me, 30 minutes of vigorous walking a day is what I recommend, but I think it should be tailored with the individual doctor and patient. Being more conscious of the amount of salt load that they're taking and the fluids they're taking in, and certainly being compliant with medicines.
There are several new medicines to treat heart failure, such as Entresto. Dr. Walensky says talking to your doctor about drugs like Entresto is important.
That patients on this drug, compared to the other therapies that have been used in the past, will live longer and reduce their hospitalizations. And reducing a hospitalization in a heart failure patient is more than preventing an inconvenience. If you come in the hospital with heart failure, you're that much closer to coming in the next time, and your life has been cut shorter. So I want patients with diagnosis of heart failure to have a discussion with their doctors about whether or not Entresto is right for them, because it's not right for everybody.